Hey YouTube, I want to take a little bit of time. I know this video isn't too long, but it might be, so I apologize in advance. But I want to take a little bit of time to talk to you guys about salt intake, cardiovascular disease, hypertension, renal issues, or anything that goes along with high sodium, and fitness. And those two, sides of the spectrum don't really seem to go well together. Not often you see a fit person roll through my ER that is, dropped down from renal or cardiovascular issues. Pretty rare. However, having said that, so we all know about salt intake. We all know that the FDA for the Americans and whoever the hell it is up here in Canada should know this, but I don't. Turn around and say, "Oh, you only should have this amount of salt in your diet." And these recommendations are based off of peer-reviewed studies that have been done in the past. And a lot of them have been done on people that are generally unhealthy individuals when you're dealing with salt intake. I won't lie. It's not that they cherry pick their participants, but they're not picking their participants on fit individuals, marathon runners, bodybuilders, genetically enhanced bodybuilders and powerlifters, and so on and so forth. They're usually just the average Joe who don't monitor their health that well. Versus fit people, what we tend to do is we tend to take our health very seriously. We eat correctly. We don't add salt to our diet, etc. So they say you should only take in this amount of salt in a day. But we also know that as the average North American, we take in a vastly larger amount of sodium than we require in a day. So then why are we told, sodium leads to hypertension, sodium leads to renal issues, etc.? Well, one of the benefits that I have with my work, for those of you that have never watched this channel, is I'm an ER nurse. I rub elbows all the time with internal medicine specialists, cardiologists, neurologists. Like, people have to come to my emergency room. Fuck, listen to me. People come to the emergency room that I work at and have to deal with my patients all the time because they're catastrophically sick, which means I'm constantly working closely with these guys. And what that allows me to do on the rare occasion when they're not run ragged is I get to just turn around and say, "Hey doc, I got a quick question for you. It has nothing to do with this patient." And more often than not, they're like, "Yeah, hey, what's up?" And I'll be like, "Oh, what about this?" And they're like, "Oh, it's 7." And I'm like, "Ah, fuck, it was 7. I knew it was 7, but I just needed somebody to tell me that." Right? So I get to ask these guys that have gone to school for 12, 15, 20 years these weird fitness questions and have them turn around and give me their opinion on it. So I feel very fortunate in that instance. So one of the things that I was watching recently was Stan Efferding, and he did a video on sodium intake. And a lot of the things he was outlining was, like performance, and how he recommends that for every gallon of water you drink, you should add 4 grams of sodium, not sodium chloride, but sodium to your water. So like flavored sodium tablets, Mediterranean sea salt, Himalayan sea salt. And he says that the average fit person, we don't add salt to our diet because we stay away from it. We eat a lot of food that's not processed, which means there's no salt added to half the stuff, like 90% of the stuff we eat anyways. And he said most of us run around at a salt deficit. And I thought to myself, wow, I drink like 8 or 9 liters of water a day. And I piss all the time. And it's not that my performance is bad. Maybe it is. Fuck, what do I know? But at the same time, I think to myself, okay, well, I'm always willing to guinea pig myself with something, Like, I'm always willing to be that guy that will try something and guinea pig it so that I can turn around and say either this doesn't work or, oh. Now, before we start, if you have never had your blood work done or you are unsure, I'm not recommending that you do this. Consult with a physician, get your blood work done, and make sure that you're not going to send yourself into a situation where you're making yourself hypernatremic, which is an excess of sodium in your blood, which can cause cardiovascular issues, renal issues, and a lot of brain issues, because there's a fluid shift that goes to your brain when you have too much sodium in your blood, if your kidneys are not able to filter it out. Let's talk about that. So he recommends that you put 4 grams of sodium in every gallon of water that you drink for performance, because we sweat a lot when we work out, we don't add sodium to our foods, and we're not getting enough of it. Okay, I thought to myself, fuck it, why not? Being at the hospital as regularly as I am, I have access to vital signs monitoring, so I can check my blood pressure and my heart rate regularly. I have access to ECGs, so I can check my heart, make sure nothing is going on. There's no irregularities and arrhythmias that I'm not aware of, that I can't feel, but they're there. And I also have doctors I can talk to, who probably think I'm kind of a wiener kid at this point for all these fitness questions I ask them. So I started adding less than what Stan recommended. I added about 500 milligrams of Himalayan sea salt to every liter of water I was drinking. So about 2 grams per gallon, half of what Stan recommended. And I started drinking this. Obviously, not just salt and water because it tastes like crap. I would add Crystal Light, right, along with the salt, make it a little bit flavorful so it doesn't drink like I'm drinking the sea. And, first 5 days, I gained about 5 pounds of fluid. And Stan says, no, that's normal. Don't stop doing it. Your body will auto regulate and you'll pee it out. All right, I thought to myself, I'll give it a try. So I checked the first week, my blood pressure went up. Oh, sorry, my body weight went up 5 pounds, but my blood pressure didn't change one smidge. Stayed at like 120/78. Okay, so my blood pressure hasn't gone up, but I'm carrying a lot of bloat. But it didn't feel like I was carrying bloat. In fact, my muscles felt larger. So I thought, okay, whatever. Like, this is all anecdote bullshit. It's in my head. I know I'm carrying water. I probably just want to think it's in the muscle. Got forward about a week, and I pissed it all out. All right? So my body auto-regulated. Now, I happened to be talking to an internal medicine specialist at the hospital, and I told him what I was doing, and he said, dude, he says, this is all placebo. He's like, if your kidneys are working properly, you're going to piss out everything that you take in. He's like, you don't have kidney issues. I said, no. He's like, right, then it's just any salt you're taking in, you're peeing out. He's like, you're not doing anything for you. It's placebo effect. And I said, okay, well, that's fair. And I thought to myself, well, he doesn't deal with anybody that's athletic. He's talking about the average person here. So I kept doing what I was doing because if it's placebo, I'll give it a go. I'll give it a try and guinea pig myself. Well, sure enough, this last week, weird things have started to happen. So at 2 weeks of having drank or taken in an extra, call it about 4 grams of sodium a day on top of my diet, my performance has increased. And I don't know why. Couldn't tell you why. My overhead press, my deadlift, my back squats, and my bench have all gotten stronger. And the only thing that's happened in the last 2 weeks is week 1, I was eating at maintenance, transitioning from a bulk, and this week I'm cutting. So now I'm at minor calorie deficit, mind you, but I'm at a calorie deficit, and I'm lifting more than I was before. And all I've done is change my salt intake. In fact, I've cut calories, so realistically, I shouldn't be getting as stronger as I am spontaneously. So now the argument comes, well, what about cardiovascular disease? What about hypertension? What about renal issues? What about neurological issues? You're taking in a lot more salt. Wow, let's talk about that. Sodium does not lead to renal issues. Excess sodium does not lead to hypertension, and excess sodium does not it doesn't cause. It can lead to, but it doesn't cause renal issues, cardiovascular disease, or any neurological issues. But it will exacerbate the hell out of those. So let's say you have renal issues. Your kidneys don't work quite properly. You get put on a low sodium diet for a reason. Your body can't filter that sodium, so it's got to go somewhere, right? Usually goes to your brain swells, bad scoobies, right? So if you have renal issues, yeah, you're not supposed to take in a lot of salt. If you have hypertension, well, what does salt do? Salt increases blood volume when you consume it in an excessive amount. Well, if you already have hypertension, it's going to fire up your hypertension to a whole new level. But if you don't have hypertension, it's not going to do that, right? Salt tends to exacerbate a lot of medical conditions, really badly too. I see it all the time. But in healthy individuals, like the internal medicine specialist said, you're just going to piss it out, right? Well, it's just placebo, he said. Okay, it's just placebo. 2 days ago, I was working up on my deadlifts. My heaviest lifts was when I was at 240 pounds. I'm now 220 pounds. 20-pound body weight difference is a big difference. And I was working up on deadlifts, and everything just felt good. And I worked up to a 590 on the deadlift, and I thought to myself, fuck, I haven't pulled this since I was 240. Maybe it's just a good day. Maybe it's just a good day. I said, okay, that's just a good day. Well, yesterday I was benching, and I did all my prescribed sets per my numbers, and it just felt good. So I said, okay, well, let's put 395 on the bar. I benched 395, and I thought, that felt easy. My current max is 405 when I last recorded it. And normally 395, it's just like a grinder of a fucking rep. Sorry for all the swearing. So I put 410 on the bar. Now I haven't pushed 410 since I was 240 pounds, but I thought, you know what? I got a spot I trust. Let's give her. Sure enough, I smashed 410. I was a little bit shocked. And I said to the guy, should I go heavier? And he says, no. He's like, fucking slow your roll. Was that a PR? And I'm like, yeah. He's like, walk away. He's like, you got it? He's like, but any more weight, you're probably going to crush yourself. So I said, okay. He's an ex-powerlifter, so I decided to listen to him. It was weird, and I'm on a deficit. I'm dieting, and I had about 5 hours sleep yesterday, and I've hit a new PR on bench without even really working up to it properly, just in training. And the only thing I've changed is salt. So anecdotally for me, my performance has increased from taking in excess salt. Well, not even excess, just taking in more salt. And I can't explain to you guys what it is. All I can do is say it's anecdote. My blood pressure stayed the same, my ECG has stayed the same, my performance has increased, and my calories have decreased, and yet I'm still getting stronger. And the only thing I've added is salt. Now, if you listen to Stan Efferding's video, he explains a lot better about his personal experience with athletes. I can't give you that. All I can tell you about is my experience with patients and myself. But I can't tell you about patients because confidentiality. But if my performance increases, and it is all placebo, and that internal medicine specialist is correct, what am I doing wrong? Like, am I doing anything bad to my body? Maybe I'm doing something right. Maybe he doesn't work with athletes and doesn't know. So I'm not going to say he's wrong, because he's a brilliant man. I've worked with him before. He is incredibly intelligent. But I don't think he's ever worked with athletes. And I don't think he's ever worked with powerlifters. So I thought, you know what? I'm just going to carry on carrying on. I'm going to monitor my blood work. I'm going to monitor my blood pressure and ECG, which I have the ability to do at work, which is a benefit that I have that most people don't, granted. Those things at Safeway that you put your arm into and like do that, not always the most accurate, but there's something if you got nothing. So for now, I'm going to carry on eating an extra 4 grams of, or drinking an extra 4 grams of salt a day for performance. And I'm pretty sure this is going to keep going the way it's going. Guys like Stan, you know, not a dummy, right? I also have a friend that's an Olympic trainer, and I ran it by him, and he said, "Well, are you deficient in sodium?" And I said, "Well, I don't think so. My blood work's fine." He's like, "Right." He's like, "So there's no real issue with taking in salt." He's like, "But if you're deficient, it's good, and if you're not deficient, you're gonna piss it out." I was like, "Okay, so what if I'm deficient and I don't know it?" He's like, "Well, then you'll benefit." So what if I'm not deficient? He says, "Then you'll piss it out." I'm like, "Right." All of these things I know. I'm borderline retarded, but I'm still a nurse, and I still did go to school for this stuff. And sometimes I just need somebody to tell me, you know, like, as long as everything's okay, you're just gonna pee it out and it'll be fine. So I can't explain it, guys. Performance has gone up in the last 2 weeks dramatically, and all I've done is increase my salt intake per what Stan Efferding recommends. So get checked. Before you ever do anything, get your blood checked. Make sure you don't have any pre-existing conditions. Talk to your doctor. Bloody hell, talk to your doctor, right? If you have hypertension, don't be doing this. If you got renal issues, don't be doing this, right? But if the doctor says, you know what, your kidneys are fine, all you're going to do is piss out any excess salt, it's up to you if you want to guinea pig yourself. All I'm saying is, for me, it's paid off. I'm actually pretty surprised. And if it's placebo, it's a placebo I'm happy to take, not knowing. That's it, guys. As always, eat like a bodybuilder. Questions and comments down below. And as always, eat like a bodybuilder and train like a powerlifter.